Like you, if you are sitting in front alone of your computer screen, if it's not going to embarrass you in front of colleagues, I would like you to get ready to clap. Today's finally the day. We left you thirsting last week for the link to the application form. The moment is finally there. I'm going to be sharing that link, but first I want to give you and ask you for a round of applause. So if you are ready, on 3, 1, 2, and 3. That's quite an impressive round of applause there. Well done, scholars. All right, so the reason we can't do applause across distance, and now we can. So yes, I hope you felt something akin to what you feel when you're in a crowd and the crowd is clapping. And I believe this is well deserved. All of you, if you're here today, despite the pressure that, or perhaps because of the pressure that COVID-19 is placing on you, you have helped us over the preceding weeks, and hopefully in ways that are helping you to continue to to build the Scholar COVID-19 Peer Hub. It's the first time, obviously, just like everyone else, we're trying to figure out how we can use what we've been doing and make it useful for those of you who are on the front lines of the COVID-19 pandemic. So a very simple agenda for today. And so from our colleague Ian Steed, we're going to have, all right, as soon as he arrives, we're going to have a quick update on the ideas engine, where we have gotten some. We're at the voting stage, so it's no longer possible to submit questions. To submit ideas or experiences, but it is entirely possible to comment them and to upvote the ones that you think are very important and that you want to pay, so that you think would be useful to you. So let me just, okay. Ian is once again in the room. I think for some reason he's not getting the link. All right. We have to fix that, Ian. Okay, he should be with us. So he'll be updating us on that. And then I'll be walking you through the application for the Peer Hub. And I'm going to explain why we're asking you, even though you have helped us build the Peer Hub, why we're asking you to complete this document. We'll go through it. And then we got several on the Telegram group. We got several people who volunteered to present information. Really, this is the heart and soul of the Peer Hub. Is about sharing of experience between peers. And so as we've been dedicating a lot of time in these Monday sessions to building the Peer Hub, we also want to go back just to the hearing some updates. What is happening? What is changing with the pandemic? What is working? What are you doing? How is it working out? So let's first go to Ian for the update on the ideas engine, and I'm going to pull up the ideas engine here. Ian, how are you doing?
I'm good, thank you, Rada. Good afternoon, and good afternoon to all the scholars. Yes, I hope this finds everyone well, and I enjoyed the applause. So very, very well earned. Listen, the update on the ideas engine, as you were aware, this was a pilot phase. This is the first time we've used this platform. And so we invited the very dedicated and interested scholars to help us test this. We've nearly 150 ideas and practices have been submitted. And obviously we've learned some things during that process. Many of you will have heard Francois Gas talking about the need for detail. And now we're at a stage where it's the right moment to put a pause to adding new ideas to the engine. What we will do, we will reconfigure the engine. We will make some slight changes so that when the new scholars arrive, it will be better. But the material that you have shared will remain in there, and it is still open. So at any time now, you can go into the ideas engine, you can read what has been written, you can comment on anything that takes your fancy, you can encourage, you can ask further questions. you can vote on the ideas that you find most relevant. So all of those functionalities remain the same and it remains open. All that we're not doing at the moment is we're not taking new ideas into the engine, but that will come again once the other scholars are inside. So that's where we
Thanks,
are with
Ian.
the ideas engine. And very importantly, we will be launching either this evening or tomorrow. We will be asking your opinion on how you have found this new tool, and that will help. There will be an online survey. You will get an email for that within the next 24 hours. And we will be asking you to be really honest. If you haven't used the ideas engine, why has that been? What has blocked you or hasn't appeared relevant to you? If you have used it, why has it been relevant? Have you been able to take on a practice or an idea? Are you maybe in the process of adapting someone's idea to what you do in your own context? Or do you think there are ways that we could make this more useful so that when we use it again in a couple of weeks' time, we really push it to be as good as it can be? So really a very heartfelt thanks from my side for taking the time and the energy and the passion to find your way into this new tool, which isn't always easy to use, for sharing so much, and really hope that we will be able to, with your help, make this as good a tool as we can for the wider group of scholars in a couple of weeks' time. Back to you, Rada.
Thanks a lot, Ian. And indeed, we know that you are the most diligent of scholars, and we really need you to give us the feedback on this experience with the ideas engine. I don't think this is just my subjective take on it. It doesn't feel like there would have been this many contributions if there wasn't something to the concept. The workshops we held with François Gass also help bring some clarity on what the issues are. But most critically, we need your feedback. This is how we work. We build this with you, for you, and we can't do it without you. So that feedback is going to be very, very important. Even if you did not have time to participate, I think Ian's, the questionnaire you're going to receive from Ian actually says that. If you just check the box, sorry, I didn't have time, I'm too busy with COVID, I didn't have time for the ideas engine. That's helpful to us. Then we need to find ways, simpler, faster ways to share ideas. And that's what we're working on right now. So back to the agenda. You can see here, second is the presentation of the Peer Hub application. So for various reasons, I won't go into into the details, but we have, we said on last Monday that we would be sharing this with you and begin to disseminate. That was a little bit over ambitious. We had some internal work to do before we could proceed. But what we are ready to do today is finally share it with you. And I want to explain. So this says it's an application form and you can apply now. But by contributing, by participating, by helping us actually build the concept and then test the ideas engine and some of the other components of the Peer Hub, you may and you should consider yourself to be co-founders of the COVID-19 Scholar Peer Hub. So then why ask you to apply? That doesn't make any sense. Let me explain. So we're going to go through the questionnaire. And if you remember in April, so a long time ago in COVID time, we asked you some questions and over 1,500 of you actually answered that questionnaire. So we're now, let me just go back so we can both look. Yeah. So we're now getting ready. The application form is not just an application form. It's a data collection tool to ask you to describe what is the situation with COVID-19, where you work, and what is changing. And we'll be able to track what is changing because some of the questions we ask in this time around are the same ones that we asked in April, and in some cases are the same as those that have been asked by WHO, so we can compare and triangulate between all those. So it's very important as a co-founder of this Peer Hub that you make your voice heard. This is where you can tell us what are your challenges, what are your priorities, because we're going to keep building out the Peer Hub and its activities, and we want to make sure that we stay as close to the ground as you are. So we need you to tell us what is actually happening there. So this may be a little bit tedious because I'm going to run through the application form, but we felt it was sort of there's enough in there that, and I am keeping an eye on the Q&A should anybody have questions about this this process. But I think first and foremost, to give you a chance, I'm sure some of you with eagle eyes have already spotted the link. But if you want to just read through what we have done, how we have summarized what we have here, you'll go through this page and take the time to read it. It should feel familiar. Now, just to say, this is a very limited release. We're not officially launching the Peer Hub yet, but we want to begin collecting this information about your situations, what has changed, what is changing. So we ask that you complete this. This will also help us test the form and make sure it works and give us your feedback on what works and doesn't work. And this will give us some initial data to see in the pilot group, perhaps it'll turn out that you were more affected by COVID than most people who apply, or whatever the case may be. So that is why we really need you to complete this this application. I just want to turn to François Gass. François, in your perspective, why is it important that we get this information from people who have been helping us week to week, and in some cases speaking up about what's happening with COVID, but this is a systematic way to collect what is happening? Why is that important at this stage?
I think you and me and many of the team are not on the front line. And frontline workers facing those problems, we hear through Scholar, through teleconference, through webinars, through reading, but we don't have the true reality that people in the field face with COVID and immunization. So I think it's the best way to have a clearer picture and to be relevant in what's going to happen in the next few weeks. That's to be the most helpful possible in executing whatever activity or strategy they have in place and sharing among themselves. So for us, it's critical to know what's going on from their perspective in practice.
Thanks, François. Sorry about the coughing. One more benefit of distance is that you don't have to worry about my cough. Alain Blaise, there's a really important question that's repeated twice in the questionnaire. It may seem like a detail, but we ask everyone to retype their email address. Why is that?
Yes, Breda, good afternoon, everyone. So yeah, that is critically important for us because we, as lesson learned in what we are doing, we keep on trying to improve, and we really want to provide you the support you need. So if you're here, so it means like you want to contribute on the COVID-19 response, and we want to help you. So to be able to be part of the Peer Hub, you really want to make sure that when you are typing your email address, you are typing it correctly. So we provide it twice, because what happened is sometimes we forgot the .com, the .co, just because we're really excited to be part of that venture. So please pay attention when you are typing your email address. But that one, if they are not matching, then you won't be able to move on with the application. So really, that's a detail, but very important.
Thanks, Alain. Yeah. And the devil really is in the details in some of these. The more attention you're able to pay, and we know it's difficult when you're so busy, but we need you to just provide the most reliable information that you can. So there is a user agreement and a privacy policy with some, where we ask for your consent to participate in research, because there is a research component, and we'll be inviting the research team to introduce this and discuss it with you, answer questions about it. So these are questions where, of course, without your agreement, you cannot proceed further with. So I'm not sure why this says submit. Okay, right, because I didn't select anything. Your pledge and commitments. So if you participated in the Impact Accelerator last year, you already know the Immunization Scholar Pledge. So we're asking you to reconfirm your commitment there. But the key ones are about your commitment to progress in the fight against COVID-19, and we invite you to take the time to read it. We're going to make an offline version available so you can read through it, so you're not paying for minutes or paying for bandwidth as you're looking at this. And then the key commitment is, in my opinion, all three are important, is really during the your commitment during the pandemic. So here you can see there's a number of points. If you disagree with any of these, then the Peer Hub is not for you, even if you have helped to build it. But I think, thank you, Sohini, for pointing out, for saying, thanks for the lovely role of co-founder, much cherished. It's true, if we are serious about building this, many people talk about being working in ways that are country-led. You have been showing us what you said and telling us about your needs and describing what is happening on the ground, as François said. So I do think that everyone who completes this questionnaire in this pilot phase should be recorded officially as co-founder. We asked for date of birth. We used to ask for age, but as the program has lasted for 4 years, that's the date of birth is actually useful. So this is just the stuff that you have seen on other Scholar applications. Remember, country of residence is not the same as country of focus. You might be a Gambian student but living in Sweden. The WhatsApp number, some people I think had trouble depending perhaps on the version of the browser or Android. So you do need to scroll through here, find your country, and then type in your local number. Let's see what else. So the affiliation and focus, that again, has got a little bit, some redundant items, but that's just because they're the same ones we've used historically. The level of the immunization system, the country of focus obviously is a key one, the years of experience. And this is so we can then look at what actually makes people who are going to go and actually do contribute significant ideas. Are they the more experienced ones, or are they the people with fresh eyes? So none of these questions are there for administrative reasons. They're not purely administrative. They're really because we want to better understand who you are, what you're doing. And as François said, it's more difficult to do over distance. We'd all rather be working together side by side. But I tell myself that if we know enough about each other, then we are effectively. So here's what describes your situation. So here we're getting into the COVID-19 specific stuff. And if you have questions, I am keeping an eye on the chat and the Q&A. So you do have another option if none of the above corresponds to your situation. So are you involved in the COVID-19 response? That would be, okay, so that seems to be, okay. How many days per week are you dedicating to COVID-19 related activities? So that's on the average, and it can be a rough estimate. What's the most critical challenge? You can always change later, but like if you have to choose one of these, which is the most significant for you? And then this, at the end of asking a group of questions, we very often have this open-ended question. So if you are in a hurry, just hit return. But if you have time to actually tell us more, this is actually super important. What are the goals and problems? What are you being asked to do by your boss, by the Ministry of Health? Because we would like everything that we do in the Peer Hub to be focused on these three things: your goals, your problems, and what you're being asked to deliver, and nothing else. Where this is not going to be a course in which we ask you to do some tasks to show that you've mastered the guideline or develop a project to, that's so kind of, everything in the Peer Hub is going to be very different and focused entirely on, the problems you are facing. And if you find yourself that the Peer Hub is time consuming and taking you away from what you're supposed to do, then we're not doing it right. And we will take corrective action to make sure that everything we do is directly relevant. Now, there's a whole set of questions for Scholar alumni. So obviously all of you will say yes. And then we are looking at, so some of you are dedicating a lot of time to the network, to Scholar activities. And so, we want to be able to measure that in some way in order to then ask the follow-up question, is it making a difference? Some people will enjoy being connected to other immunization practitioners, but the real question is, we're not building this as a social network for people to enjoy themselves. We're building this because we think it can make a difference. So answering these questions are around that. If you say yes, you'll be asked, how often do you communicate with scholars? Is it once a month? So let me ask Marta and go. Marta, how often do you communicate with scholars? If you're able to speak to us.
Hi, Reda.
Hi. Yes.
Okay. I think I communicate with scholars on daily basis.
Okay, so more than once a week. All right. And what was the main reason for your contact? it's probably more than one in your case as a
For
team
some, for some, I serve as accompanist to them.
Yeah.
For others, as a team leader, and some others just to encourage them.
All right. So we'll say, yeah, related to implementation, even though it could be B, C, or D. And how many, if you try to count up, how many scholars would you go to for opinion about, a COVID-19 related problem, for example, or advice? How many scholars would you go to? And I realize I may take some reflection. So that was a question to you, Marta, but let's ask Mohammed Imran Qureshi. Imran, how many scholars you feel comfortable? You can just call them up or send them an email or just send them a message on WhatsApp and that they'll give you back, that you feel comfortable asking them.
Yeah, thank you, Rida. In my opinion, this number could vary, but I would go for option number C, 4 to 7.
All right. And Imran, how many scholars do you regularly communicate with?
Again, that varies, but generally I'll go for B because at times there is minimum number 1 is always there.
Okay. And would you be able to name 3 of the scholars that you've contacted in the past?
Yeah, that could be like one is Muhammad Rizwan, the other one is Ahmad Naveed Nusrat. Probably both of them are there in this session.
Indeed.
And then we have our own federal EPI, Mr. Naeem. So there are many, but 3 names I can spell out.
Great. Yeah. So the point of this is called social network analysis, and the what we'll be looking at is what does the network actually look like? Who's connecting with more people than others? Who is being cited as a person to refer to? Those are the kinds of questions. That's why does participating in meetings like these Monday meetings, is it helpful? That's one of the things we want to know. Otherwise, we'd be the first ones to say that we need to find some other way to spend our time in during the pandemic. But of course, we're betting that there is something there, and I don't think, and I believe that belief is shared by people in this room. We need to put that to the test and prove it one way or the other. Now, if you participated in the Impact Accelerator, there's a kind of overdue question we should have asked a while back. Oh, for some reason, I'm unable to progress here. Okay, here we go. So, we want to know, how have your implementation efforts been affected by COVID-19? That's important. If you participated in the accelerator, you had a project, are you continuing to work as planned? Is it more difficult, or have you stopped? We want to sort of assess the consequences, and then you can tell us more. And that if you did have a project that things have changed because of COVID, we need to know that to be able to measure what's happening with the projects. And then in the last 6 months, of course, if you'll answer no, if there's no meeting of scholars in your country, but in most cases here. Now, the next section is about team leaders and COVID-19 focal points. So, if you want to serve as a country team leader for a country that doesn't have a team leader, or if you want to offer your services as a new team leader or as a COVID-19 focal point, you click yes, and there's just, I think, 3 questions for that. Then we get to the questions about the impact of COVID. So here you can see to what extent these are the same questions we asked back in April. Are the services continuing as usual, in a limited way, suspended, or you don't know? And so we'll be able to go back and compare that to what we had before. Same here, vaccination campaigns, are they postponed or interrupted? That's most likely, but we would like to be able to actually measure that within our network, knowing that the network is not necessarily representative of the entire country, or but that's what we're going to be looking at. And then catch-up planning, again, we're interested to know if you're working about that, and then we do always have a open question here that you can review. Next is motivation. So this is familiar territory but again, the difference is that here it's not motivation for the course, is how motivated are you to solve, to tackle this COVID-19 problems that you're facing. agreement from do you have your supervisor's agreements? And then, you have, if you're involved in data collection, analysis, action in line with your country's plans, directives, and WHO recommendations, does your supervisor agree with that involvement that you have? And I'm just looking, I see there's one question. Okay, that was from Rosemary, who seems to have gotten an answer. All right, thanks, Rosemary. So how are COVID-19 and its consequences likely to affect your availability? So option A is time only if the peer hub helps me with my COVID-19 work. That's ideally how it should work, but there's some other options. Which of these is most important to you? So these are the various things that we're hoping to provide through the peer hub. So you'll have to choose one of them. And of course, we'll be looking at that list we're going to build, showing how many people are interested in what. And we know it needs to be, it needs to be to the point. It needs to be directly, immediately, relevant to your needs. So that's what we're going to build together. Now, I think this, how will this help you improve your work and deliver the results? I think this question is actually better in French. We need to switch to retranslate it. This, at the end of the day, we're not doing this as a course so you can earn a certificate and develop your skills in a specific area of, a technical area. We're doing this because we know you have problems to solve. You've been pulled into the response to the pandemic. Your services, your work is being affected by the pandemic. So you tell us, if you're here, or for people who are not co-founders but who are going to be applying, how you think this will help you. So for Ahmad Navid Nusrat, who asks, will this help in immunization issues only? So we have decided to really focus on the immunization services. But if you are an immunization person and you've been pulled and now you're spending 100% of your time only on COVID-19 response, you will be welcome to the Peer Hub. We know that your knowledge of immunization services, you can tell us, you can tell people and share with the people in your country group what is happening with the response. So we had a EPI manager, for example, who's now responsible for COVID-19 operations. It's obvious that he's going to be welcome in the Peer Hub as well. If there's a need, we're hoping, of course, we will be inviting our colleagues from WHO HQ and from the regional offices to share and come and explain the advice, the recommendations, the guidelines. So we just want to confirm how many of you need support to use this advice on COVID-19 and immunization. Do you have questions, challenges for which you haven't been able to find the advice that you needed? So those are very important questions. Obviously less relevant for this very connected group, but we still will ask you the same questions for obvious reasons. And then you can tell us more about the advice you need, the questions and challenges that you faced. On data for action, so if you're not sure of what data for action approach actually means, then there's that is definitely an option. It is something relatively new from a SAGE recommendation in 2019. We briefly discussed it a few weeks ago. So if you answer, I'm not sure, that's that wouldn't be a surprise. But and then some specific questions if you're involved in reporting any of these. And there's obviously one item that sticks out, which is quite not usually likely to be something that you report on, but and it's just one or more of these. DHIS2, if your country has such a system, both collect and compile data, but also access the data. And then for those of you who have not yet contributed to the Ideas Engine, you'll get a chance to do it in a different way without having to put in a login or password or any of those things on the specific platform, but really using this form. And you've seen, if you applied for Teach to Reach, you saw these questions. If you have an idea, a success story, a lesson learned, a challenge. And then, of course, we'll ask you what was the challenge. We have the 3 top ones here, but we have other categories, so you can put in your own challenge here. Or if it's an idea or something you've already done, and then tell us more. And of course, if you are in a hurry, knowing that this is, that we do not want this to become a time suck, to put it crudely, to take your time that you should be dedicating to something else, just hit return if you don't have the time. But if you do have the time, this will really help us make sense of what is happening and how we can best tailor the peer hub. Then come the questions that you're familiar with about the reliability of an internet connection and YouTube and so on, and where you are able to connect to the internet. So that is a new question. Then that is where those are the questions you have seen before. And then here there should actually be a prompt to submit, but that is where you actually put in the questionnaire. So I see a question from Asena Bwakia. If a person is no longer part of the implementing process directly, but would still want to learn from the peer hub, can they still enroll? So let's go to Masena, and let's hear more. If you're able to speak to us, would love to hear more from you about what is your situation. I know you completed Teach to Reach level 1. Okay, and I'm just asking you to unmute, but you may not be able to speak, and that's fine. So briefly, answer is yes. If you think it's useful for you in some other way, if you'd like to stay connected because for whatever reason, then yes, definitely, you should. And again, as a founding member, then we're asking you to complete the application, not to determine whether we will select you or not, but because you have earned a seat in the peer hub by helping to develop it with us. So that's, let's go to Gloria Archibong. Gloria, you have your hand raised, and we're at the half-hour mark, so we're going to shift over to asking for people to give us status updates on what is changing with COVID in your context. So Gloria, I'm asking you to unmute. You should be seeing a prompt on your screen, and again, a reminder to update your Zoom application. They are making many updates, and it is very important that you do so. All right. Okay, neither Gloria nor Masena are able to speak to us. Let me see, I think there's one more question. Okay, no, that was Masena's question, so I have answered that. So if you still want to learn from the peer hub, yes. Now, all right. Okay, so that's, let's go back to the agenda. And now it is time for the second half of the meeting. So let me give again the Alain Blaise and others that have shared it. This is the link. I want to thank and acknowledge Rajat Garg. It is true, we said we would give it to you right away. So apologies, Rajat. I wanted to personally say that we appreciate you and others who contacted me throughout the week. It's a bit, but we want to get this right. Even though it is new, even though it is innovation, even though everything about this is unprecedented, if it takes a few more days to get it right, we owe it to you to respect you. We respect you so that we will take the time to get it right. Okay, so I know that there are individuals who said they would be willing to update us. Atahir Abubakar. Let me see if Atahir is here. Yes. Okay. Atahir Abubakar, welcome to you. Yes, we hear you, but it's very faint. Could you speak up or increase the level on your microphone?
Can you hear me clearly?
It's much better. Yes. Remind us where you are connecting from, what you do, and then what's your update? What is changing? What is working against COVID-19?
Wataru Abubakar by name. I'm calling from Nigeria, particularly Zamfara State. I support routine immunization activities in the state, and I support contact tracing of COVID-19 in the state. Currently, what is working, community mobilization, people to be, so that people will take all necessary precautions against COVID-19, using face masks, physical distancing, avoiding crowd areas. So that's currently what is working, but we're having some challenges in the crowd control in our facilities, especially the CMAM centers where nutrition supplement is being given. So most of the women are coming from rural areas to access the services of the CMAM. So it's difficult to control them, but we are trying our best to make sure that there's limited crowd in those centers that are providing the CMAM centers. Thank you very much.
Okay. I'd like to turn to Francois. to determine, to better understand what is happening, where Attahir is working. What questions, Francois, would you have for him? What else would you want to know?
I would like to understand better I understand clearly that the strategy to prevent COVID, but I am not sure I understood that there was a crowd control. But the crowd control, what are the cause of this crowd there? Why there is a difficulty in the crowd control? I need a little bit more explanation.
So what brought the difficulty in crowd control? Most of the people assessing the CMAM services are coming from a rural area.
CMAM, I don't understand CMAM services.
Okay, it's a nutritional supplement given by UNICEF to malnourished children.
Ah, okay.
Community for management of acute malnutrition.
Okay, now it's clear, yeah?
Yeah, it's management of acute malnutrition among children. So most of the service people that are coming, caregivers that are coming to assess the services are coming from rural areas where there is no network, so that we can arrange the time of their visiting. So they just come in anyhow, and some are new clients to be enlisted. So at times you find more than 50 clients in a facility waiting to be enlisted. And when you try to make them, when you ask them to, okay, observe physical distance, still there's this little denial of COVID-19 is an LI disease, all other sort of things. So these are what causes crowd to be difficult in controlling in some of the centers.
That's very clear now, and it's a sudden increase of the number of women because they have no access where they are, and they come to town and they become 60 or instead of 10 or 12, I suppose.
Yes.
Now, how are you addressing it?
What we are doing now, we just started it last 2 weeks ago. Any woman by the gate of any health facility, you collect a card. When you collect a card, then the chairs are being arranged by 2 meters apart. Then we allow you to enter and sit. And most of the centers, we allow them to pick 20 caregivers per time. After the 20, then we allow next batch of the 20 to come in.
Okay, and does this work, or are you seeing some benefit of this approach, or you create even other problems?
Yeah, it's working. It's working in some areas, but in some areas still they troop in because the facility has no perimeter fencing, so they can come in anywhere.
I see. And is this, do you have the same problem with immunization during the COVID?
No, we don't have the problem with the same problem with immunization. For immunization, we mostly conduct it on alternate days. So, but for the CMAM, it's once in a week. So that's why the crowd is there.
Did you ever think of doing alternate days for the CMAN, or it's very complex and not really feasible?
It's only the way they design the project is for once in a week. Their staff come from an area to a different area because they categorize the state into some areas. So this week they will be in this area, next week they will be in another area. So that's what is causing some difficulty in the crowd control and spacing.
So it's an issue of offering the services, multiplying the site of offering those CMAN access is difficult and is challenging. Can you tell me why? Is it sort of alternate days? Is lack of staff, lack of human resources, or what are the root cause of the problem? Is it the design of the project and the difficulty to get more people in? I'm not sure I understand.
Okay, the design of the project makes it that the center will operate once in a week, and we have limited centers in the state. We only have 46 centers across 647 health facilities. So only 46 centers we are having. So the founder is only supporting these 46 centers. So they have limited number of staff that can go around all the 46 centers.
Yeah.
So
Okay.
they divide the staff on weekly basis. They will be in one center, 2 centers, 3 centers. That's how they divided the staff. So based on the design of the project, that's how it has been designed.
Okay, thank you very much for. And your last question: do do you have a way to monitor what's going on to see why it works less well, or is it difficult to monitor for you?
We are monitoring it. We know some of the centers that were having challenges or overcrowding. So normally we divided the state team into those centers so that they can be there and manage it. The only area we are having more challenges, those facilities without perimeter fencing. So anybody can come from anywhere and enter, but those facilities with perimeter fencing, we can block the gate and issue a cut. First come, first serve.
Okay, okay, no, that's very interesting. Thank you very much for sharing with us this challenge and the way you're addressing it.
Thank you.
Thank you, Francois and Ate here. I see Khalid Abubakar, who also has his hand raised, also from Nigeria. I suggest we go to Rajat Garg, who I know had asked. And Rajat, we'd love to hear from you. I'm asking you to unmute, hoping, yes. Okay, welcome. How are you doing? Remind us where you're connecting from.
Thank
and
you.
Tell us what is changing, what is working against COVID-19, where you are.
Thank you, Reda. Regarding COVID-19, definitely awareness is very important. As you know that social distancing, mask and sanitizer, use of sanitizer, that is SMS, is the need of the hour. And with increasing awareness, definitely in a country like India, we are able to flatten the curve so as to reduce the burden on the health facilities. Although the number of cases is increasing, they are more than, you can say, 5 million as of now, but still we are able to manage.
Oh, gone.
In the United
Rajat, is there any way you can improve your connection? I think he just dropped off the call. Yes. Okay. So let's go to Khalid Abubakar. Khalid, you are a longtime scholar as well. Let me ask to unmute. Yes. Tell us, remind us where you work in Nigeria, and tell us what is changing, what is working. Okay, and I know you were a second ago. You were available. Let's go to Amsalu Shifara and Daniel Haruna. Now I am noticing, and this is why we're hoping. Yeah.
Good evening, Rida. Can you hear me?
Yes, loud and clear. The floor is yours.
Is Dr. Khalid speaking from Nigeria? Can you hear me loud and clear now?
Loud and clear.
Yeah. So definitely, this is very exciting platform for us to share our experience and some of the challenges we are facing our way forward. I'm from Nigeria, working at the subnational level, supporting the EPI unit in Bauchi State. Just to share with colleagues what is happening, what is changing during COVID. It's very difficult and challenging situation where people are actually facing a lot of information overload and then a lot of stigmatization.
Oh, you gone?
Yeah, I think we just lost Khalid as well. All right.
Conducted. Can you hear me?
Yeah, we lost you for a few seconds, but you're back.
Yeah. So declining sessions conducted against plan, and then declining turnout in some of the facilities, and then some of the health workers were infected because of the poor knowledge of IPC, so as to prevent themselves, and inadequate PPEs. So gradually, when we realize that, we emphasize on how we can educate our health workers so as to ensure they can conduct their service safely without infecting and without being affected by the COVID. We organize trainings for sensitization of health workers. We provide PPEs, though it's not adequate, but we have given them, and we give them simple rules on how they can be able to use and utilize, especially hand washing and then the physical distancing. And then we are facing issue of defaulter tracking, because going to the community, defaulter tracking at times is very difficult because of the risks in it. So gradually we organize in such a way that we update the information of defaulters and share with the community prior to the sessions, and then we started seeing some improvement in the turnout of the client. So basically, the challenge we have in decline in sessions and the dropout that was increasing, when we notice for the second quarter, we have started seeing some improvement now based on the indicators we have. The number of sessions has been increased, and then the defaulters is actually uh, decreasing. So this is so far what is changing. And then the issue of triaging was emphasized at every facility. And then we build the capacity of the health workers so as to be able to have isolation area where they have a suspected case they can be able to keep. And then we expand our surveillance system to do community search and then health facility active search so as to be able to build the confidence of the health workers and to be able to identify any suspected case so as to improve the service. If not, people will not come to the facility when they see any suspected case, for example, or maybe they had history of someone with COVID in the facility, they may not come. But when we build that capacity, we realize that people actually become more aware of how they can be able to manage themselves and be able to protect themselves from COVID, and they continue community services. Thank you very much.
Thank you, Khalid. Before we go to François Gas, let's try hearing from Rajat Garg once more. I know how frustrating it can be when your connection does not work. Rajat Garg, are you there? Are you now able to speak to us? Is your connection holding? Okay, unfortunately, you're still breaking up for me. I don't know if...
No, I cannot hear
No.
it.
All right, Rajat, of course, this is one of the limitations. We have 60 of the most dedicated scholars connected to this session, plus the team leaders, and unfortunately, sometimes that's just how it works. Let's go to... So, Rajat, if you'd like to write your comments into the chat. I saw you typed SMS is working against COVID, sanitizer, mask, plus social distancing. All right. And thank you to Samuel Sulea Jansan and Olufunmilola Digbita and others who have been sharing in the chat as well. Now, this is one of the reasons why this application, what we're calling the application, but it's really a data collection tool to update what is the situation now in July versus what it was at the end of April. So it's really important if you would like to be a part of this, if you see how this can be useful to you, our commitment is that we will share the data that you share with us, what you tell us about your situation. We'll give you a picture country by country, and we'll give you a global picture of what is happening with COVID-19 in different across the Scholar network. So let's see, we have 12 minutes left. Let's go to François Gas. François, do you have specific questions for Khalid Abubakar?
Thank you, Harid, for clarifying and explaining what's happening in a very concrete ways. I think you started by saying there was a declining in immunization. My first question, how did you find, was it just reported, or was it based on looking at some indicators? That would be my first question. Then I will move to the next.
All right, I'm asking Khalid Abubakar to unmute. Hello, Khalid Abubakar.
Hello?
Yes, there you go.
Yeah. So, yeah, thank you very much for the question. You know, we actually have indicators using our DHIS2 platform, tracking the sessions conducts and against the planned sessions. So based on that, we realized that the sessions that were planned were not conducted as expected because the target is about 90% was session plan to be conducted. And we realized that across some of the LGS, it's about out of 20, about 11 were having suboptimal performance of session plan was conducted. And we were able to do field visit to the LGS to find out why is it that we are not having as expected number of sessions. So that's how we were able to understand the reason, and then we develop action plan.
Good. Thank you very much. That's very, very concrete. The number of session planned, executed, and you reacted. That's called data for reaction in a way. More than data for action is data for reaction. And you collected. Now, when you choose your solution, which was equipment and sanitizer, social distancing, was it part of your plan, or was it in reaction to the data you collected when you did the field visit?
Yeah, it is already part of the plan that we are going to cascade the training and then to ensure that we provide all these necessary PPEs. But when we realized that the session has been declining, and we realized that some of the reasons were the reason of maybe inadequate knowledge of IPC, inadequate PPE, we fast-track the process to be able to provide them as soon as possible for the health workers to resume working without any maybe cancellation of sessions.
Thank you very much. My last question was, did you combine, you talk about the community as well, the confidence within the community, and equipping those health facility with preventive measure to reassure the staff, the one offering the service, give them knowledge, and to reassure the community. Did you do it together, or did you start it? Sometimes it's very difficult to get all the equipment in place. And have you been able to do it together, one after the other? How did you manage that at the field level?
So we did it combined. Already we have existing surveillance systems, surveillance structures, where in the community we have community informants who are already in the community and they are sharing with us information regarding occurrence of vaccine preventable diseases within the community, like measles, AAP, and other things. So we were able to just sensitize them on how they can be able to go house to house to find out those that are sick or those that have recent dates and those that are having COVID-related symptoms based on the case definition. While in the aspect of the facility, we actually develop an ODK apps where health workers go into facility by facility asking for or maybe searching for information in the registers for any suspected COVID. And then based on that, we're able to follow up with those that are suspected for testing. So that is the strategy. It was having to be combined, but it was very difficult, definitely.
I think you really highlight the fact that it's a multifactorial. The drop in session, the drop in confidence, in fact, is multifactorial, and you've been able to address each factor, because if you drop one, then maybe you're not as successful. And so thank you very much and maybe I was wondering, you have enough human resources to do this community contact and to restore confidence? You had enough staff to do it?
Yeah, actually, we have existing community, but we have to give them some form of incentive over the days, like 10 days, so that they can be able to help us in sorting out. And by then, we are thinking of community separate, where people were not willing to volunteer to come for testing. But after we do that, we're able to sort out house to house with the facility combined, so that we can be able to achieve maximum number of people that we are thinking they are having suspected case. We test them. If they need isolation, we isolate. So
and do you see now improving? You have your data, the data you have looked at, look like improving, or are you able to see that things are going up?
Absolutely, we have seen increase, because the health workers were able to have confidence in going to the community for outreach and for fixed sessions confidently without being fear of being infected, which initially was one of the factors that actually stopped them from having some of the regular sessions.
And this monitoring is done at district level or at state level? What's the level where they look and say, we're doing better, we see an improvement? At which level do you do that?
Yeah, we started with the state level, but later on scale off to other states. That is from state to the national. We first of all make it initially in Lagos, so then later on we scale it to other states.
Okay, thank you very much. It's a very interesting experience.
Yeah, thank you very much.
Thank you both. All right, we only have 6 minutes left. I want to, again, go over. It may not be entirely clear for everyone, and I know, Imran, you wanted to share the experience from Pakistan. I want to make sure that after this session, as everyone is going to go fill out the questionnaire, your deadline, as we know you are very diligent, even when you are very busy, is Friday. So you have this week to do that. But it's very important that everyone in the group do so. The kinds of questions that Francois is asking to really go further in terms of making sense of what is happening in the situation, what is changing, and what is being done about it. That is going to be the focus of exercise 1, as well as implicitly a focus of the idea of, as part of the ideas engine, in which you will be invited in the next round to submit ideas and experiences. And this time there'll be a very specific focus. We all know that your Ministry of Health or your boss, someone is asking you to do something about COVID, has tasked you with getting certain things done. So you may already have a plan, and in this case, the exercise will be to strengthen and improve that plan and learn from what others are doing in your country and in other countries. And then you will use that to improve your action plan so that your boss or your Ministry of Health or whoever is waiting for you to deliver the results will be even more impressed than they would be if you did not have this support. So that's what I mean when I say it's not a course, it's about helping you do better, go faster than you would without the network. The other thing is that we heard several participants from Nigeria, and there are obviously a very, we're proud to have a large number of people, immunization professionals from Nigeria who are participating, who distinguished themselves, as did participants from other countries in the Teach to Reach and in the data improvement courses, a country group that in many ways has been very active. And a lot of it is clear that in a session like this, we are 60 people in the room plus 11 people, team leaders, and the scholar team. We have heard 3, 4, 5 voices, and so a lot of the action is going to be happening through the country teams, and we'll be looking to the team leaders and to the COVID-19 focal points. And if there's no one who is ready to be team leader, no one ready to serve as COVID-19 focal point, then in that country, there's a lot less that's going to happen than in countries where there are. And that is fine with us. We are not, we certainly would love to see action in every country. We know that is unlikely to happen. But a part of the, you will find, I sort of skipped over it, but you will be able to volunteer to indicate that you are interested in serving your scholars from your country, so that Abu Bakr and Atahir can meet in the country group, discuss and their issues, and perhaps figure out how they can work together with other people from Nigeria and people from other countries, from Ghana next door, can do the same, and so on. So that is a very important part of the Peer Hub, but actually it's already part of the Scholar system, and you experienced it, many of you, in the accelerator. So I just wanted to highlight a few things here, and let me see, we have some hands that are still up, but as we're running out of time, just want to ask, let's go to, let me see, yes, it's hard to choose, there's so many good people in the room. Let's go to Ibrahim Abdullahi Maikano. So I think, and I'm especially looking for names that I know we haven't heard from before. And we're hoping through the profile you'll fill out for the Peer Hub, to join the Peer Hub, we'll be able to get to know you, even if you're too shy or you don't feel the confidence to be able to just raise your hand and speak up, as we've heard from some of the speakers today. Otherwise, we're just going to go to the... we have 2 minutes left. Okay. Ibrahim.
Hello, sir. Yes, sir. Good evening, Dr. Reda.
All right. Good evening to you. You have 2 minutes.
Yes, sir.
Okay,
like... sir. Yes, I'm Ibrahim Abdullahi Mekano, and I'm from Bauchi State, where Dr. Khalid has just spoken. We are from the same state. He's a mentor to me. Really, we're involved in this COVID-19, which it has not even has an impact on the health facility, but it also has an impact on our day-to-day activities, because in fact, actually, there are a lot of setbacks because of the activity and stigmatization and rumor that is going on. Of recent, I want to share a kind of experience that I had. Hello, sir.
Yes, we hear you. However, we
Yeah.
only have 1 minute left, and as you, so I would say, are you going to go and fill out the application and tell us about what is happening and what is changing there? That would be the
Okay,
best
sir.
way to do it.
I'll fill out the. Okay, I'll go with the application, sir.
Okay, great. Yeah, and
So
I'm
far
sorry.
there is no time. I'll go with the application.
In the Peer Hub, once we get started, we'll have many different ways for you to share with us, with colleagues from Nigeria, with colleagues from other countries. We're going to be organizing exchanges with people between country groups. So there's a lot more ways in which you'll be able to get practical support and contribute what you're doing. Thank you
Yes,
so
sir.
much. Wishing you
Thank you
and
very much.
everyone in the Peer Hub, consider yourselves as of today, as soon as you finish that application, consider yourself as a co-founder of the COVID-19 Scholar Peer Hub. Thank you.
Thank you, sir.
And
Thank you.
take care.